We're live. Hello, and we're live. I am Kat with Rebloom Room, and today I'm talking with Dr. Michelle Scullock. She is an internal medicine physician currently in Charlotte, North Carolina, and we are going to be talking about how to stay healthy while you're traveling, especially when you're traveling internationally, and sort of talk about more how to stay healthy in general and what to do if you actually need to access medical care while you're traveling. So, um, Dr. Michelle, why don't you introduce yourself and talk to us about um, why you started, how and why you got into this sort of travel health uh,
Sure.
area?
Um, yeah. First, thanks so much. I'm really glad to be here and to have this discussion with you, Kat. As Kat said, I'm Dr. Michelle Scullock, and by training, I'm a general internal medicine physician. I practiced for over 25 years as a primary care physician, and over the course of that time, it really changed. Um, well, especially in corporate medicine, we were being asked to do more with less time, with less staff support. And so as I began to sort of think about what I wanted my next part of my practice life to be, I started to think about what I enjoyed. And right then the pandemic hit. And that was not a time to leave. If we think about the very beginning of the pandemic, it was a really serious time. We were dealing with illness and serious complications, especially in my community. And so physicians were really in more of a collaborative space than we had been before. And a lot of that was occurring online. The Italian physicians were seeing things that they hadn't seen before, and COVID was acting very differently for the seriously ill. And so I actually went online in some of the physician spaces to learn kind of what we might be faced, as, COVID became more severe here. And that brought me to a number of online communities because I had not been online before. But after we got through sort of the worst of COVID and we had vaccines and things started to open up, then I started to revisit my next set of plans. And one of the really wonderful things about being a primary care physician is that people share everything with you and they bring
Mm,
to you all of their issues. And so I really liked helping people medically prepare for travel. So I was able to take what I loved with my experiences and with my knowledge and move into the online space and have a discussion in this space that I didn't think we were having before
mm,
when it comes to travel. So now with my stethoscope travels, I get to talk about what to do before you go. I share
mm.
tips with staying healthy while you travel. And if the unfortunate and unexpected occurs, then I also review where to seek medical care abroad so that travelers feel more confident, have less stress, and ultimately more joy when they travel. So I like to think of it and say, prepare to have fun, because it
Yes,
doesn't always have to be doom and gloom when we talk
yes.
about these things.
Yes. Thank you for that.
Sure.
I wanted to say before we continue that Dr. Michelle is a medical doctor, but she is not your medical doctor. So this is educational. This is not medical advice. So just know that if you do have medical issues, you need to consult your own private physician to get guidance and
Yes.
advice. Thank
Thank you.
you. Thank
I appreciate that disclaimer. That will make my attorney
you.
very happy.
Yes. Yes. So yeah, the medical field is changing. I know in at least where I'm based in DC that it is really hard to find a primary care physician because of in part because of how hard it is to be a primary care physician. There's a lot of paperwork, the insurance, the overhead, it gets less and less about patients and more about paperwork is what I've heard from various doctors. So,
Yes,
yeah, I
yes.
understand your desire to move away from that environment.
Yeah.
So, mhm, go
I
ahead.
was just gonna say, and there's a lot of corporate interference.
Mhm,
Sometimes patients feel that when the insurance companies tell you what medications you can and cannot have, and they're
mhm,
telling your doctor what they can and cannot write.
yeah,
And so that adds a different level of difficulty because I can say, well, I can speak for myself, and I do know a lot of physicians. We entered this for a completely different reason,
mhm,
to really help. And so it can feel at times very confining and very restrictive in certain environments. So,
yeah.
so yeah, it's difficult for patients and physicians alike.
Yeah, it is. So maybe we can talk a little bit later on about the differences between the United States and, for example, the Italian or, you know, different countries around the world, sort of those different health systems. But I guess what I mostly wanted to start with was sort of why is it so important for people to think about healthcare before they're traveling? Um, and sort of what would happen if you don't prepare, what's the worst case scenario, not to get scary, but just sort of to understand, like, why is this so important?
Yeah. Um, when I talk about preparing, I think of it as because life happens. Life can happen at any time. Some things when we travel can be anticipated. If we're going to cruise, we know maybe we should think about motion sickness and take
Hmm.
medicines for that. Or if we're going to high elevations, we might think about, medications for altitude sickness, et cetera. So certainly some things can be anticipated, but a lot of times the unexpected happens. And according to our State Department, the most common being, traffic-related accidents. That can be sort of one of the more serious things, but people can have heart attacks too, and that's quite serious. But many times it's just maybe the acute, meaning sudden or new illness that's not necessarily life-threatening, but can cause an interruption in the trip. I'll give an
Hmm.
example, and this is going to tell on me. So, when my family and I went to London last year, it was sort of a last-minute trip. It was only going to be a week, and typically, when I travel, I take a few things into account. Like, do I speak the language? And like, how difficult will it be to access care? Like, am I going to a low resource area or an area that has a lot abundant resources I can easily access? And we'll talk about probably accessing care at other places in just a moment. But I perceive this to be an area of high levels of resources that are easily accessible. I spoke the language, and because we were only going for a week, we only were going to take carry-ons. So I didn't want to take my usual bag of stuff, and it's a literal bag
Oh,
of
your
stuff
little
that
frozen.
stays packed and
Hmm.
I throw it in the suitcase when we go. But I didn't take
Hmm.
my usual bag of stuff because, if we needed something, I'll just go to the pharmacy and buy it because pharmacists there can also prescribe things too, as in many
Hmm.
places. But, I'll just if we need something, I'll just go get it. It won't be that serious. I was traveling light.
Hmm.
So we get to the hotel. We were staying in a hotel. A lot of times we don't stay in hotels, we'll stay in Airbnb. But this time we were staying in a hotel. And because of what I do, I stopped and talked to the concierge, which is one of the things that I recommend people do if they're staying in a hotel, and had a conversation with him to confirm what I had read online was actually true, both about their national health services, where to access care while we were there. He told me about the pharmacy around the corner. They had a pharmacist in the basement that treated. It
Oh.
was good. He confirmed what I thought I knew. Good.
Hmm.
We went on about our business. I didn't think that I was going to need that information
Hmm.
uh, in short order. So we, start our vacation, and both my husband and I became ill.
Hmm.
We had we think, some dairy from the buffet. Now, I normally don't eat dairy off buffets because you can't know how long it's been out there. But I thought,
Hmm.
we're in London. They know how to
Okay.
treat clotted cream.
I
Wrong.
was making notes. Don't
So,
eat buffet dairy. Okay.
so I varied from my usual routine and paid for it. What I didn't factor when I didn't bring my bag is that if two people are sick at the same time, or this could be true for a solo traveler,
Mm-hmm.
who is going to go get the medicine in the high resourced area?
Mm-hmm.
So, so I from now on will take my full bag, which includes the things that I would have needed. Fortunately, it was, a short-lived illness, and we went on and
Mm-hmm.
enjoyed our trip. However, there
Okay.
was a trip interruption there in terms of, like,
Mhm.
what we were able to do and not do because we were ill at various points.
Right.
So,
Was the
I say
concierge
life
would the concierge would the concierge been able to get you something? Were they able to get you? Yeah, so you
yes,
could lean on
and
that.
so that is true. So we were when one stays, at hotels, many times they have doctors that they can access to make house calls.
Mm. Mhm.
And if we were that seriously ill, we would have gone that route, but we
Mhm.
weren't. This was more of a, you need to be near the bathroom for a few hours,
Mhm.
more than we needed something more serious. So we were able to actually switch off and go out and
Mhm.
get our water and
Yeah.
the dehydration salts and all the
Mm.
other things that we needed because the
Mhm.
pharmacy was so close,
Okay.
and able to talk to the pharmacy and pick out exactly which of the local
Mhm.
products would
Mhm.
be best for our
Right.
symptoms. So in this case,
Okay.
we didn't need someone to come to us, but we were able to access healthcare
Mhm.
in that way.
Okay. So, burning question, what is in your bag? I know you're a physician, so yours is probably, like, packed, but sort of if I'm packing my own bag, what would you recommend to put
So
in?
there's a lot, and
Do you have
actually,
a
if
list?
you
Do you have a
go
list on
to,
your website? Okay.
I was going to say, I yes. So if people are interested
Yes.
and they go to mystethoscopetravels.com,
Mhm.
there is an international packing list that I recommend that has some of my favorites on there.
Okay,
But
good.
briefly, things like things for cuts and scrapes. So like a basic first aid kit with
Mhm.
antibiotic ointment, band-aids. There's Pepto-Bismol, or I don't want to use actually brand names. So various anti-diarrheal medications
Wait a
are
minute,
on there.
wait a minute.
Yeah,
You mean
and I'm sorry, what? Yes, right, right. I should have the bag here.
Yeah, I'm in
So
Mexico, I know.
yeah, so exactly. Yes. So some of those types of things, um, things for indigestion in
Mhm,
general. Um, when I go abroad, I will go in my primary physician's office and request a couple of antibiotics just in case,
mm,
things that will treat a UTI. Um, for women, they may want to request an antifungal medication if they don't like to use the ones over the counter. So, but as I said, there's a list on
okay,
the website. I
okay, I'll
typically, if I'm staying in a B&B, I'll take like
mhm,
a carbon monoxide detector, but take the battery out. Put the battery in your carry-on luggage.
okay,
So yeah, so a variety of things. But you're
okay,
right,
I
my
will
bag is typically bigger.
yeah, I will add a link to your,
Okay,
list, packing list, in the description later. Okay,
sure.
perfect, yes. Good. Okay, so yes, but that's not really the worst case scenario. Like that's a kind of a, very light. You can handle it. Even if you're traveling on your own, it would be uncomfortable, but you could probably handle that by yourself. But, medium case would be you're in Lisbon, it's raining. You slide on one of those slippery cobblestones that they have there,
Yes.
and you twist your ankle, possibly sprain, fracture, break it, then what do you do? That kind of thing. I mean,
Right.
anything can happen. Yeah.
Right. And many times because of the well, because the cost of healthcare is cheaper than here, um, many times if we buy travel insurance, that will be less expensive than paying out of pocket. But
Mhm.
even if we don't have travel health insurance, I would encourage people not to be hesitant to seek care abroad
Mhm.
because care costs are lower, and there are many qualified people that you can find through the State Department website. They have a list of English-speaking doctors, clinics,
Oh,
hospitals in various locations
okay.
that travelers can access before they go,
Okay.
and know and therefore know where to go should they need something more than what they have in their bag or can get from the pharmacist.
That is great. I did not know that the State Department kept a list of English-speaking doctors abroad.
Yes.
Nice. Okay, good. I know also there's an app that I downloaded from Mexico. I don't know if other countries might have it, but there's one that has, um, like you can put in your location in Mexico and it'll tell you
Oh, that's great.
doctors. And I don't know if there's English and or other language speaking
Mhm.
doctors. I
Okay.
can put a link to that too. Yeah.
Yeah, excellent. I'd like to
Hmm.
know that.
Yeah.
And then, of course, there's also on the mystethoscopetravels.com website, there is a section for healthcare abroad for the top 40 destinations. And
Mhm.
so that, you can
Mm.
check that out too as a resource.
Okay. And that is going to have lists of doctors, hospitals, that kind of thing, then whatever
Exactly.
the 911 emergency numbers kind of thing.
Yes.
Okay,
Yes,
great. So
exactly.
if you're thinking of going to Thailand, you can look on My Stethoscope's Travels and say, okay, then you can look at that. So what's the intention with that? Like people, if they know they're going, what should they do beforehand?
Exactly. So that's a really great point is accessing care, emergency care really starts before before you go.
Mm,
And there are four things that I made a note of to be sure to mention um, to do before you go to ease the process. Um, and we've touched on a little bit already, but number one is identify the doctors at your destination and along your itinerary.
mhm,
Um, and that can be, as I mentioned, with the concierge, that can be in advance if you're in an Airbnb with the Airbnb host, or
mhm,
if you're house sitting with the homeowner,
mhm,
because they will have, best sort of information for what's going on locally at that time.
mhm,
And then the US Embassy website, as I mentioned before, and my website will also have some information. So that's the first thing is to look up the doctor and
mhm.
write them down because it's hard to think in an emergency, and this is not a time for the phone to die or not to have issues
Yeah.
accessing the
Okay.
the
So put them on
local.
paper,
Right, put it on
print it
paper,
out.
exactly.
Okay.
Uh, Third thing is look up as you said, look up the 911 equivalent. Spoiler alert, for Europe, it's mostly 112, but there are other numbers around the globe. And then
Mm,
the fourth thing, I think a lot of times we forget to do, at least I know I'm guilty of this, is to write down the list of medications that includes the names, dosages, and how you take them. So, for example, if it's Tylenol, it would be acetaminophen, 500 milligrams, one tablet 3 times a day, and have that translated in the local language. This is especially
mm,
important for solo travelers or
mhm,
if you're traveling with people who don't know the local language. Now, your pharmacist and your doctor's office may be able to help you with that because on those
mhm,
papers that they give you when you check out or when you pick up your medications, they have programs where they can automatically translate that to some languages. So if you don't
mm,
speak the language either, then
mm,
you may be able to reach out for some additional resources for that, or go through your app that contains your medical
mhm.
information. Sometimes that's able to do that too.
Oh, wait,
And
do I have an app that has my medical information?
some
Do I
people
have one
do.
of those?
I don't know. I don't know.
Not
Epic is very
yet.
in the States, Epic is very popular, or MyChart. but
Okay, my chart. I know. Okay, so that's like for my doctor's office or whatever.
right.
Okay.
So you may
Okay.
be able to manipulate that. And
Ah,
then for people with heart problems, bring a hard copy of the EKG as a and part of your little packet of things.
okay. All right, this is a lot, but yes, okay, a lot to think about, but it's
Lots to
very
think about.
important and
But it's
like
really
it's
good
just part
things.
of our travel planning. Yeah, it is.
Wonderful.
Pack your kit, talk to your host, check in with the concierge. And when you talk to the concierge, if you're not a physician, what would I say? Would I say, "Hi, I'm here and I'm really a planner, so like give me the deets." But I guess
It
that's what they're
wasn't
talking,
it wasn't
right?
that odd. It may seem odd or unfamiliar,
Mm,
but it wasn't really. They get all kinds of questions. But
okay.
I said, "Hi, I'm checking in. I'm from this state. What do I do if I get sick?"
Mhm.
And and then I said, I've read that you have National Health Service that's free for emergencies.
Mhm.
And then he was able to confirm and to go on from there. So the simple question is, what do I do if I get sick? And
Okay.
that's all. And they will take it from there.
Aw, okay. Oh my goodness. Abba! Oh no. I'm sorry. How was that? So Abba says I recovered from COVID while in Bangkok, Thailand 10 or so days ago.
Oh,
Really?
I hope you're
Wait,
feeling
I
better.
thought weren't you just in South Africa, Abba? I mean, you get around, girl. I would like to know how that went. If you had to access medical care while you're in Thailand, and how, if so, how that went, and if it cost something, how much it was. Well, I hope you're feeling better, Abba. I'm sorry to hear that, but I guess you're having a good time, so that's good. Hopefully, you're fully recovered or close
Yes.
to it. Yeah,
Yes.
yeah. Um, Yeah, so oh, yes, she was just in South Africa. Yes.
Okay.
She's traveling. Good. Yeah, so, I
That's the
mean,
life I'd love to have.
I know, right? It's coming. It's
That's
coming.
right. It's coming. It's coming.
Yeah. Alright, so what else do we need to talk about? So, before before you leave home, we talked about getting your travel kit, talking to your host beforehand, making a list of the doctors, downloading any of your medical information that you need, any medications that you take, and printing it out on paper so you have it. What else?
Travel insurance.
Oh, yes, travel insurance. Travel insurance. So, about a week ago, I met a young woman who was on her way to somewhere in Asia. And I think she might have been going on a program or something. So they required her to get travel insurance. And I was like, oh, that sounds good. She's like, well, I don't want to get travel insurance because I never want to have to use it. And I was like, wait, what? Wait, what? How? Let's talk about travel insurance because
Yes.
I feel like if COVID taught us nothing else, it was that if you're going to travel, it stuff can go down really quickly and it could get really ugly if you don't have the support you
Mhm.
need. So, travel insurance is just one of those ways that you can help yourself get the support that you need a lot more quickly, right? They have like
Yes.
800 numbers that or whatever, toll free number that you'll be able
Mhm.
to call with an English speaker who can help you navigate the healthcare system where you are.
Yes.
Let's talk travel insurance,
Let's talk
please.
travel insurance. So there there are different kinds of travel insurance. There's travel insurance that kind of protects your investment in your travel, like it covers your flight or your lost bags.
Mhm.
If your flight's, weather delayed and you miss your connection or your cruise, when you have to stay in a hotel or whatever, covers those
Right.
things.
Mhm.
There's travel health insurance, which I think we're going to probably focus a lot
Yes.
on, or travel, same thing, travel medical insurance that
Yes.
covers the costs related to your illness and sometimes
Mhm.
illness with your close relative that you're traveling with. So, like if you're
Mhm.
traveling, with your spouse and your spouse gets ill, then and the trip is, halted for everybody, it's everybody in that party. So
Right.
there's travel health insurance, and then there's medical evacuation insurance or medevac insurance, um,
Mhm.
which will cover you and cover the cost of transportation if someone gets sick, especially if someone's traveling remotely or to
Mhm.
remote destinations, and the
Yeah.
care that that's needed is not there for them, and
Mm.
they have to be airlifted to somewhere else. So that
Mhm.
medical evacuation insurance covers the cost, which can be really expensive.
Yeah.
At minimum, it's like 25,000. It could be
Mhm.
six figures, but that
Mhm.
insurance covers relocation to a destination, and a
Mhm.
subset of that is repatriation, which gets you back to your home country. So
Right.
for medical insurance, there are lots of plans, and
Mhm.
some will cover just that trip. For people who travel more than 3 times a year internationally, having a year plan might be a more economical way to go.
Mhm.
And then when looking at those plans, there are a lot of specifics in the small print that you wanna look at. It's like, how
Mhm.
much coverage do I want? Um,
Mhm.
if I have illnesses now, will it cover my pre-existing illnesses and when? Like, is there any kind of
Mhm.
lag period, which is also important for digital nomads or people who like to bop around? Like, is there any kind
Yeah.
of lag before that insurance kicks
Mhm.
in? Um, so those are some of the things. If you're, skydiving, will it cover those adventure activities? So those are the things to look for. I was just talking to somebody. You mentioned your person who didn't want to use it just in case. Um, I was talking to somebody last week who told me this story. They were in Scotland with their husband, and who had been doing fine. All of a sudden, he doubled over in excruciating pain. They called the ambulance. They came and got him, took him to the hospital. Now, that's part of the UK, so they have the national healthcare system. They didn't ask them for anything. Took them to the ER, etc. Evaluated him, started his
Mhm.
treatment. When it was determined that he needed to have his appendix out, which is a
Mm.
surgery,
Yes.
they asked for a credit card.
Hello.
So that was the point where the free care stopped. Now,
Mm.
one of the things that people may wanna look at when they're looking at insurance is the payment a reimbursement to you? In which
Mm.
case, have a credit card.
Mhm.
Or do they pay the hospital, doctor, clinic, etcetera, directly,
Mhm.
and right then and there? So that can also be a factor,
That's a
and
huge difference.
yeah, that is a huge difference. So they ask for a credit card right then and there. One of the differences, because you talked about we're gonna talk about differences. One of the differences, in addition to access to care, is a a transparency of cost.
Mm. Mm.
That they told them what the price would be, and that is one global fee. That's all they were gonna pay. Didn't matter how
Oh, for
long he stayed in
everything.
the
Oh.
hospital.
Oh.
Didn't matter what he needed while in the hospital,
Oh.
it was one global fee, and the doctor
Wow.
determined how long he was gonna be in the hospital.
Mhm.
But according, to the person I was talking to, she mentioned that wasn't the real cost. Where the travel and medical insurance really would have been helpful in her case was he stayed in the hospital for 7 days. That's 7 days of accommodations they had not anticipated.
Mm.
Once he got out of the hospital, he had to be released to fly home,
Mhm.
and the doctor did not release him to fly home for another 7 days. So
Right.
that's 14 additional days
Mhm.
of accommodations,
Yeah.
which during high season or in a hotel can be a lot more expensive than both the cost of surgery and the cost of a travel medical insurance policy.
Yeah. Yeah.
So I would submit that for people, especially people who are bopping around for long periods of time,
Mhm.
um, digital nomads, it's really helpful, I think, to make that plan so that they're not some sudden
Yeah.
costs that could be really
Yeah. Yeah.
Big
So
deal.
I just think it's so important. It would just make me so uncomfortable to just not have that,
Mhm.
just because you never know.
You never
You just
know.
never know.
Yeah.
Walking on the sidewalk, you could
Okay.
injure yourself, right?
Yes.
Um, so I just wanted to come back to Abash. Luckily, okay, she didn't have to access the healthcare system in Thailand,
Okay.
but she was supposed to go to the Democratic Republic of the Congo, but now she
Yeah.
is, I guess, maybe leaning into her hopefully
Yeah.
travel insurance. Yeah, so political unrest, like that's and so you all like there are those insurances, those travel insurances that you just buy. Like sometimes when you buy a ticket, United will say, "Hey, don't you want to buy some insurance?" And that's
Right.
just about their part of the travel.
Mhm.
But then you could get a health insurance plan that includes, travel insurance that relates to your flights and if anybody needs to come and help you, if you get sick, there are certain insurance plans that will fly some help, help somebody get over to where you are if they need to help you translate, take care of you, whatever it is. So,
Exactly.
yeah, looking at the fine print is never fun. But yeah, and there are a lot of different policies. There, you can, I also have a link. I'll put a link if I didn't already to Square Mouth, which is the service that I use to sort of plug in. You can kind of plug in your variables and they'll list out insurance plans from different companies that you can use. And Abba says she uses Safety Wing, so that's another popular one for people who travel a lot. And Safety Wing can help you with. I think they cover health and um, you know travel, flight and things like that. To cover hotels if you ever got bumped from a flight or something like that, and if they if the
Yeah. There was
airline didn't want to pay for it. Yeah.
yeah. There was an article in Forbes recently that mentioned Square Mouth as being the best affordable plan. So
Yeah.
that
Well,
was
it's for me, it's I think it's just a platform.
mhm.
And it'll like list out different
Listen.
companies. I think it's a really great platform. It's super helpful. So I'll have a link to that below. Um, Safety Wing, very popular with people who travel a lot. Yeah. So yeah, let's talk about. Go ahead. I hear
Oh, I
you.
was going to say, um, some people may already have some coverage and not know it. It
Mm,
may be with certain credit cards,
mhm,
and some US-based insurance companies have plans that have an aspect of travel medical insurance.
mhm,
For example, Humana and Blue Cross Blue Shield have Geo Blue, some of their plans.
mhm,
Cigna has Cigna Global.
mm,
So check to see what you may have.
mhm.
That's a quick call to the customer service line to see if you
Okay.
have any
Right.
hidden benefits that you may have forgotten.
Yes. Yes. The credit card benefits. Yes, that's true. Yeah. So much fine print to read. So many calls to make.
They don't all have to be in one day.
Okay. But yes, it's a part of our travel planning that will help us have more fun because then once you've got this set for yourself, then you
Think
don't
about it.
have to be worried. You can be prepared, not scared. So, yes.
There you go.
Yeah. Yeah. Do you want to talk about sort of the differences in different healthcare systems? So, like in Britain, for example, we do have the National Health Service, NHS. When I was a student there, I was able to just walk in and get, my health care taken care of without opening my wallet in one way, in any way, shape, or form. They would write prescriptions, they would do exams, x-rays, whatever I needed. I have heard in like the Middle East, for maybe Dubai, for example, where if you don't pay up front, but wait, no, wait. If you don't pay, they won't let you leave the hospital, or they won't let you in. I don't know, but yeah, very different systems everywhere you go, right?
That could happen.
Yeah.
Um, some places offer more direct access to the physician and more time with the physician, so patients may notice that difference.
Mhm.
More house calls. Some of this I kind of touched on.
Mhm.
Pharmacists can treat some
Yes.
minor things.
Yes.
Price transparency, I think I mentioned, but
Mhm.
the biggest I think is access,
Yeah.
because the taxes really heavily subsidize healthcare in the public system, and many times there's both a public and a private
Mhm.
healthcare system,
Yes.
where the taxes subsidize the public healthcare system,
Mhm.
which is available to people many times without regard to your residency status. So just
Mhm.
to the visitor who gets, twists their ankle, et cetera,
Mhm.
up to a point,
Right.
as I mentioned before.
Right.
Um, and then with the private system, it may just be straight out cash. When
Mhm.
I had, but that the costs are going to be the less. I had an occasion to visit an ENT when I was in Lisbon in December. I
Mhm.
had a problem with my ear that I have never had before on descent in the
Mm,
airplane, and so
mm,
um, I
how
went.
painful.
Yes, it was, but I'm pleased to report, end of story, is it's all good.
Mhm.
But, at the time, I could not hear, and so I was able to see an ENT physician one-on-one at
Mhm.
5:30 PM. It was a same-day appointment,
Mhm.
and my bill was €80, which is
Mm,
less than $90.
yeah.
Um, Cash, no insurance.
Mhm.
Okay, I told on myself. Well, I had some insurance, but not insurance that would have covered this.
Mhm.
Um, and it was, €80. Now, I would not have been able to do any of that here.
Mhm.
Um, uh, yeah, I could probably put a period right there.
No,
Um,
no.
Hour of the day, same
Yeah,
day,
yeah.
cost, well, my copayment, but I
Right,
may have had to pay a percentage that
right.
probably would not have,
Yeah, it would have probably been an emergency room visit with a
yeah,
longer wait and
right, exactly. And oh, this was interesting because it was something I didn't anticipate, that I'm not sure if it's just unique to Portugal or not, but
mm.
he both printed my prescriptions and he emailed them to me, so that
Oh,
when I
you.
went to the pharmacy, like, I printed the prescriptions, but they were also on my phone, so that if the pharmacist just needed them, they could have just looked at my phone and
Mhm,
gotten what I needed, because
mhm,
they didn't confiscate the prescription, they
mhm,
just filled it. Now, it wasn't anything controlled, so,
right,
maybe if it were a different type of prescription,
mhm,
it might have been different, but the filling was very, easy. It was done in a
mm,
matter of minutes, so
nice. And about how much did the prescription cost to fill?
I had multiple things, so they were $10 to $20 each,
Mhm,
or, let me say, 10 to €20 each, but the
mhm,
doctor apologized because I was going to have to pay for those
mhm.
prescriptions, which if I had a residency card, they would not have cost me anything.
Okay, nice.
I didn't
Okay,
have to be a citizen, but if I'd had a residency card,
right,
my medications would have been, free or very,
right.
minimal charge.
Yes. Okay,
But
good.
I was not sad. That would have been
Yeah.
at least what I would have paid with my insurance, so
Yes. Yes. Good. All right. So, and do we have information? Do you have some stories about folks who have been maybe in Asia or like the Middle East or in Africa somewhere? Yeah. How are those
access.
systems comparatively speaking? I know Asian um, healthcare system, especially the private healthcare system, tends to be pretty nice.
Yes, very good, low cost. But they really, yes, very good low cost for private systems. Um, Africa can really vary. I mean, the
Mhm.
continent's huge,
Yes.
and
Yes.
and what's available in some parts of the continent, um, Ghana, South Africa, may not be available in other parts. So it can
Mhm.
really, that really can vary. So I think when one decides to on their itinerary, it's a good idea to get with a travel medicine specialist or a travel medicine doctor and talk about kind of where you're going and to help you
Mhm.
anticipate what the challenges might
Mhm.
be both to access and what you might need in terms of
Mm.
shots and medications and things to take with you.
Nice. Is that a service that you provide to people?
Yes, I do.
Yay. Okay, good. So if you're going to, well, not the Congo right now, it doesn't look like, but if you're going to the continent or Asia or someplace where the medical system is a lot different from the States, you might want to consult with Dr. Michelle to figure out your plan and take some of that worry off of your shoulders.
Yes.
Yeah, good. Excellent. Excellent. All right, let's see. Yeah, I think we covered what I wanted to cover. Is there anything else that you feel like we should have talked about that we didn't yet?
I think we covered a lot of it. I think we
Mhm.
covered a lot of it. If there are questions in the chat, I'm glad to
Oh,
answer
yeah, I did
those.
have a question that came across IG, which was about someone who's traveling in the UK and is looking for medication that has run out. Um, I think it was a psychopharmaceutical, if that's the word,
Mhm.
maybe something like a Wellbutrin or a, ADHD med, something like that. How would that work?
Those can be because some of those are controlled and at least for ADHD medications, some of those can be more difficult to access and would require not necessarily a pharmacist
Mhm,
appointment, but
mhm,
an appointment with a physician.
mhm,
Um, I would say that's a really niche question. If they wanna
mhm,
email hello@mystethoscopetravels.com, I can, help them get in
mhm,
contact potentially with a person there who might be able to see them and prescribe,
mhm.
what they might need.
Perfect. Thank you. And what if it were something non controlled, like, I don't know, what do people take?
Right, right, okay,
What do
yeah,
people
so
take?
for a
Yeah.
non a cholesterol medicine or blood pressure medicine,
Yes. Yes.
something
Yes.
that's not controlled,
Hmm.
maintenance medication.
Hmm.
So, um an option, for people before they travel is to, take 3 months with them, or if they bring their bottle,
Hmm.
or their prescription from their doctor and take that to the pharmacy, many times the pharmacist can help in terms of refills, at
Okay.
least enough to help during their travel.
Okay. So they may
If
or may
there's
not have to see a doctor.
Yeah,
Just a
exactly,
pharmacist. Okay.
right.
Okay, good. Good. Let's see if we have any questions. Oh, any advice for Black men? Can you be more specific?
Yeah, I was gonna
Advice
say,
if
all of
you're
this is for Black men too.
be wonderful, be yourself, be good,
Yeah,
be happy.
be out there.
Go out
Yeah.
there. Yes.
So, yeah, something,
Yeah.
any
Yeah. This
particular concern?
Yeah, and this advice wasn't really any of the advice is for men or for women, really. It's for everyone, I think. Yeah.
Um,
Oh, good. Abba is fully recovered from COVID. I'm very happy to hear
Great.
that, 'cause that is
That's
not
good to hear.
fun. I mean, it's never fun to be sick when you're traveling. Never
Yeah,
sick. Never
no,
fun to be sick when you're traveling. Not at all. All right. Well, I wanted to put a plug in while we're talking about travel for a retreat that I'm organizing. It's this coming April, and it is in Mexico City, and it is, yeah, it's going to be a wonderful time where we relax and we explore and we connect with each other. So it's a retreat for Black women who are ready to explore Mexico City, but don't necessarily want to go on their own. We're going to be together. We're going to eat delicious food. We're going to take naps. We're going to do yoga. We're going to just be together. So I have a link to that retreat in the description below. So please check it out if you're interested. We still have spots as of today. So all right. I don't see any other questions. Beautiful Dalat, Vietnam. I want to be in Vietnam sometime soon. All right. All right, Dr. Michelle. Um, Tell us where we can find you again so that people can connect.
Sure. So on YouTube, my stethoscope travels, where I talk a lot about, again, what to do before you go, and traveling, and staying healthy while you travel. And to shout out your retreat, I would have to say we didn't talk about mental health when traveling, but
Yeah,
retreats as a way to maintain good mental health is
yeah.
one of those things. So I'm interested in. So YouTube, my travel medicine blog is at mystethoscopetravels.com, and on IG, where I post videos there as well, under My
Mm,
Stethoscope Travels too. So all the same
mm,
name, YouTube,
yeah.
IG, and the website.
Okay, well, I've taken a lot of notes and I'm going to do better about traveling. I have my pink bottle, not to mention any names, but I do but I do need to up my first aid kit game. I definitely am going to be doing that. Oh, here he has a specific question. Okay. Let's see. I travel extensively. World Traveler says, I travel extensively and usually have private medical insurance, but have challenges using it. As a result, I contact in-country insurance for coverage. Do you recommend
Okay.
this? Hmm.
Yeah. Yeah, that sounds like that's working. So
That's interesting.
great. I
Yeah,
hate
I
that he
never
had
thought.
trouble and
Yeah, that's
challenges
weird,
using
right?
it.
Yeah,
Yeah,
I guess I would not use those companies then,
yeah.
and maybe when I go on, Squaremouth and look for, a travel health insurance policy, I look to see, how many they have a 1 to 5-star rating or whatever,
Mhm,
and I don't remember whether they have reviews, but, like, part of the rating is, can people use it once they need it, right?
mhm. Right,
'Cause it's
and ease of reimbursement.
pointless to have it if you don't if it's not usable. So,
Right.
yeah, like, do they have an 800 number? Do they pick up when you need it? Do they have, interpreters? Do they reimburse you when they say they're gonna reimburse? How quickly? So that kind of, at least that star rating will tell you that
Yeah,
in their history of reimbursing people that they're good. So maybe just I don't know which travel insurance was not working for you, and it could be that in certain countries maybe um, some insurance is harder. I don't know, but what do you think about
yeah.
that?
Yeah, I think that's true. And there may be a mismatch too of coverage of not
Mm,
having good services in country. So I think World
mm,
Travelers' approach is a good one.
mm. Yeah, I never thought of contacting in country, especially if I guess if you're staying for a while, that could be good.
Mhm,
I can't imagine that like an in-country insurer would do like a 2-week thing. Like that would be kind of hard. But if you're staying for a year, yeah, for sure. Or 3 months even. But like for a
mhm.
short travel, like if you're bopping around, that would be
Right.
hard. Yeah.
Yeah, especially from places to place.
Yeah. Yeah. Um, but something like so it's safety wing and then there's another one. What's the other one? Safety wing and global nomads or
Faye,
nomads something. What did you say?
Faye, Faye. That was
Oh, I don't know that
one.
one. Is that
And
that's an
Tinleg
old.
has medical and
Mhm,
evacuation insurance.
mhm.
I don't know if
Yeah,
anyone
and
said that
Finleg
one.
is one. Yeah, I've used them before and they've been pretty good. I haven't needed to use it, so actually I should say that. I like it, but I haven't really needed to use it. But I've been satisfied with like their coverage amounts and the
Yeah,
sort of cost to me for that coverage.
yeah.
Yeah, but
And
it sounds like World
World
Nomads.
Nomads is another one, and that's one that
Yeah.
actually covers those adventure
Mhm.
activities
Yes, that's what I was
too.
thinking. World Nomads and the one that ABBA uses, Safety Wing. Those are probably the one that I hear the most, but in addition to Cigna, the Cigna Global and the
Mhm.
Geo Blue Cross or
Blue.
whatever, if
Mhm.
you're a US citizen or maybe Canadian. Those 2 might also be good. Yeah, yeah, something. It sounds like you might if you do travel extensively, you might need it like a year long. if you're bopping around. Yeah, good. Good, 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 good. Look into that. Good. All righty. Okay, I think we did it.
I think
Everyone,
we did.
please go to Dr. Michelle's socials and connect with her. And if you have specifics, please reach out to her so that she can provide you with some help. And, you know, you can use her years of experience to help you plan your travels. And if you enjoyed this conversation, please subscribe to the channel and hit the notifications bell so you know when the next video drops. And yeah, thanks for joining and thanks for watching. And thank you, Dr. Michelle. It's been a wonderful conversation and very informative. I'm going to up my planning game a little bit more. Yeah, I appreciate your experience and your knowledge. Thank you so much.
Thank you for having me. I appreciate it. All right. Take care. Safe travels, everybody.
Thank you. Bye.
Bye.